This is a speech for Mindy Avery. And this is her audience. Okay.
I'm Mindy Avery, and this is a speech for my Introduction to Speech class requiring the use of a visual aid. I chose to do my speech on setting up and maintaining a sterile field and what to do when that field is compromised. Maintaining a sterile field is crucial because according to Eric Castango, 22% of all hospital-acquired infections are due to improper sterile technique. It can be life-threatening, but it is avoidable. Things that you can do as nurses that would involve sterile technique include wound care, respiratory suction, anything in the operating room, and inserting a catheter. And I have a catheter kit here today to demonstrate setting up your sterile field. The first thing you always do before you do any procedure is wash your hands, and that's also, even though you are going to be putting on sterile gloves, you want to wash your hands first. A lot of times after you see doctors or nurses scrub in and wash their hands, you'll see them hold their hands in front of their face, and that is because they can see whether or not anything touches it or contaminates. If they reach behind for anything, they no longer can guarantee that that hand is clean. Also, they hold them up so that the water drips down from clean to dirty, as opposed to the water dripping back down their fingers and bringing germs and bacteria with it. So, when you're opening your kit, you always want to take this paper. You have an inch of the border here to work with. You don't want to cross that line. It's not really a line, but you don't want to go any further than an inch in because that's your sterile field. You always pull away from you first, and that's how they are wrapped anyway, so even if you forget, you kind of have to do it like that anyway. Don't let your paper hang off the edge of the table because easily, somebody could walk by and just brush it very easy. So you can manipulate it as long as you stay within that 1 inch field. Next, you have this drop cloth, and this is specific for your catheter, and that is just a place over the patient to provide privacy. I'm sure you all are familiar with this. So I'm just going to put it to the side because we don't have a patient today. So under that, the first thing you will see are your sterile gloves. You want to carefully pick these up, and once they're in your hands, do not put them anywhere on your sterile field. It is now considered clean because you are clean, but it is not considered sterile. So you want to put it to the side, make sure you've left yourself with plenty of space. And again, use that 1 inch imaginary field to open your package. With these gloves, it is folded in at the side here, so just anything in that fold you can grab onto to open. It's labeled left and right glove, and they're pre-set up for you to easily be able to slide your left or right hand into. The first thing you do, and I'll pick this up to show you, your cuff is folded in both gloves. Now I picked this up on the outside of this because once I put it on, this is going to be what's touching my arm. So you can pick up the outside. Do not touch anything else on the glove, and don't swing it around like I'm doing right now. So you take your hand and you slide it in, keeping your finger on the outside of the cuff. And if it gets folded like that, you can't fix it. You just need to leave it the way it is because anywhere you touch, you're going to contaminate your sterile glove. So just keep in mind that you have an exposed part of your hand for now. I'll show you how to fix that next. With the next glove, you reach inside the cuff. That's sterile, and this glove is sterile. So you'll reach inside there, not on the outside, and you'll slide your hand in there. Now both of my hands are sterile. So I can go to this glove and pinch the outside, because both sterile, and just kind of pull on it and manipulate it until you've covered your hand. And it may not be perfect, but my hands are completely covered. So now you can touch anything in this sterile field. Remember, anything outside of this inch is not sterile, and you don't touch anything anywhere else. You can pick anything up, Anything in here is sterile. Once you use it, it is no longer sterile. If you have an assistant or somebody that is scrubbed in who is just clean, you can pass a package to them, or they can hand you a package, and typically they'll open it. I don't have an example here, but most medical tools have a flap on the top so that they can be pulled apart with the instrument sticking out, so you just reach in and grab your sterile instrument. And now you have your sterile field. Anything below your waist or table height is not considered sterile, so do not drop your hands down. Do not turn your back on your sterile field. It's the same thing as putting your hand behind you. If you turn your back, I turn my back, I can't see this, and I can't guarantee 100% that this field is still sterile. You don't want to reach across your sterile field for anything. You are constantly shedding layers of skin, so you could have bacteria from your own skin drop, not to mention that your gown or scrubs or clothes can brush against something and then your field is no longer sterile. If you do contaminate your sterile field, you have to completely scrap it and start over. Say I'm holding this and it becomes contaminated, I put it down over here not thinking. It's contaminated, this is gone, it's done. Your best bet is just to not touch it, or if there's someone who is not scrubbed in or who is just clean, they can get rid of it. But if you were to set it here and then pick it up, now your gloves aren't sterile. Now you got to start completely over. Another way to contaminate your field is whenever you're putting on your gloves. These are fairly thin, and so it's easy, especially in an emergency procedure, to just pull that glove on and stick a finger through it. Commonly, you see doctors just put another sterile glove on over it, but the proper way to do it is to discard the gloves and put on new ones. And that pretty well sums up setting up a sterile field and how to prevent from contaminating it. And again, if you do contaminate it, it's not the end of the world. Just get rid of it and start over, and that protects your patient from infection and ensures proper sterile